Hello, today we are aiming to educate allied healthcare professionals regarding Ambulatory Surgical Center Quality Reporting, VBP. In today's topics, we are discussing what is value-based purchasing, learning objectives, the goals, measures, reporting requirements, incentives and penalties, and how quality of care in the U.S. is impacted. Today's learning objectives: we would examine the measures, reporting requirements, and methodology. What is VBP? VBP stands for Value-Based Purchasing, which is a program through the Centers for Medicare and Medicaid Services initiative that rewards acute care hospitals with incentive payments for the quality of care they provide to Medicare beneficiaries and based on the quality of care they deliver. The program adjusts payments to hospitals under the Inpatient Prospective Payment System, which is also known as IPPS. This form of payment holds healthcare providers accountable for the cost and quality of care they provide, reducing inappropriate care, identifying and rewarding the best performing providers. The goals of CMS seeks to develop a comprehensive set of quality measures to be available for widespread use for making informed decisions and quality improvement in the ambulatory surgical center setting. The ASCQR program aims to promote higher quality and more efficient health care for Medicare beneficiaries through quality of care measurements. The ASCQR measures payment determinations based upon endoscopy and polyp surveillance, cataracts, facility 7-day risks, and normothermia, as well as voluntary measures. What are measures? Measures is an initiative that identifies the highest priorities for quality measurement and improvement. It involves assessing the core issues that are critical to providing high quality care and improving individual outcomes. The minimum reporting requirements for 2020 would be clinical outcomes, person and community engagement, safety, as well as efficiency and cost reductions. In order to meet reporting requirements and to receive full payment update, ASC must meet data collection and submission requirements. A QualityNet security administrator will have to be designated to submit documentation for a QualityNet account at www.qualitynet.org 4 to 6 weeks prior to any quality measure data submission deadline. The security administrator will be responsible for reporting web-based measure data via using a web-based tool and will also be able to access available data submission reports. If CMS determines that an ASC did not meet the ASCQR program requirements for the calendar year, the ASC may submit a request for reconsideration to CMS. The request must identify the ASC's specific reason for believing it did not meet the annual payment update requirements and why they should receive full APU. Hospital value-based purchasing is funded through a reduction from participating hospitals' DRG payments for the applicable fiscal year. The money is withheld and redistributed to hospitals based on their TPSs as required by statute, and the actual amount earned by hospitals will depend on the actual range and distribution of all eligible participating hospital TPSs. A hospital may earn back a value-based incentive payment percentage that is less than, equal to, or more than the applicable reduction for the program year. Next slide shows the step-by-step calculations for value-based purchasing. Step 1, we have calculating achievement points and improvement points for each measure. Step 2, determining the measure or dimension score. Step 3, calculates the unweighted domain scores. Step 4, determining the domain weights. And Step 5, calculating the weighted domain scores. Step 6, calculating the total performance score. And in the next slides, you will see examples of the calculations step by step. Incentives and penalties. ASCs report quality of care data for standardized measures to receive the full annual update to their ASC annual payment rate, beginning with calendar year payments. And the penalties for ASCs not meeting the reporting requirements or allowing the data to be publicly available may incur a 2.0 percentage point reduction to any payment update provided under the revised ASC payment system for that year. How the VBP impacted the quality of care in the U.S. The VBP impacted the quality of care in the U.S. by reducing costs, increasing patient satisfaction, reducing medical errors, informing patients, promoting healthy habits. And in conclusion, we examined the measures for ASCQR, the reporting requirements, payments, step-by-step calculations, incentives and penalties, as well as how the value-based purchasing has impacted healthcare in the United States. And the next slide, it shows the reference slide. Thank you.